Good evening, everyone. I'll be presenting on retinal manifestations in demyelinating disease of central nervous system. This is a study we conducted at RP Center in AIMS, New Delhi, along with the Cardio Neuro Center in AIMS, New Delhi. The basic introduction, everyone knows here that demyelinating diseases involves involvement of brain, spinal cord, and sometimes eye as well. There are various multiple diseases known as multiple sclerosis, neuromyelitis optica spectrum disorders, MOGAD, and other non-MS inflammatory disorders. Visual symptoms are commonly found. Optic neuritis is the most commonly described presentation, but retinal findings are very less described, or they are infrequently described, and major of them are described in a retrospective manner. In a cohort of MS patient, cohort of a uveitis patients. The uveitis patient was evaluated and seen how many of them had MS. It was not done in the other way around. So our focus was to study the MS proven cases, MS, MOGAD, and MSD and other diseases, and to find retinal and uveal manifestation in those patients. So study design, we did a descriptive observational study in which we recruited 50 patients with proven diseases from neurology department. Then inclusion criteria was consent, confirmed diagnosis, age more than 8 years, and exclusion criteria was demyelinating diseases from infectious etiologies. Patient evaluation was done, history, treatment history, and systemic examination, following which we did an ocular examination in which we best corrected visual acuity, IOP measurement, pupillary reaction, contrast sensitivity, slit lamp examination, fundus evaluation, swept source OCT angiography, ultra-wide field fundus photography, and ultra-wide field fluorescein angiography if required, if we found some lesions that may require angiography. So the results were as follows. Majority of our population was female, 32 females out of the 50, and mean age was 18 to 30 was the mean age. Majority was multiple sclerosis, and they were mainly on the treatment. Some had steroids, some had azathioprine, DMF. So the vision loss, when we saw the patients, we did not evaluate the patient under the attack. We evaluated patients who has a history of MS, and currently they are not having any ophthalmic symptoms. So some patients had good vision, like 67% has normal vision, then 19% mild vision loss, and moderate in 4%, and severe in 2%, and legally blind were 8% cases. This is according to ICD-11 classification. The findings we found was pars planitis, microhemorrhages. Obviously, optic disc pallor was the most common finding, as you will all expect. But the other findings were a bit revealing, like vascular sheathing, microhemorrhages, which were not previously described, vessel attenuation, and there's a non-specific depigmentation we found in around 10% patients, which was not described anywhere. So this was the laterality of the findings we found. So some findings I'm showing you. This is a RP hyperplasia. You can see I have marked it. Then there were vasculitis-like features, neovascularization with hemorrhages and vascular tortuosity, and there was resolving vitreous hemorrhage inferiorly. Then a non-specific depigmentation. This we found in around 10 of our patients, which was not previously documented, but a bit more research is required to study them. Disc pallor was the most common finding, as I told already. Then vessel deposits. You can see this is not an artifact. We have confirmed this because sometimes in optos imaging the artifact can be mimicked like that, but these are vessel deposits we've seen in multiple patients. These are the two photos I've given. Then vitreous deposits like focal astrohyalosis like changes we can see in the vitreous. Then microaneurysms were found in some patients in the periphery. Then there was a peripheral retinal atrophy along with RP hyperplasia was seen. And the results were, overall the prevalence was 60% among the patients of clinically proven MS and other demyelinating disorders. Most common age was 31 to 45 years. Majority was a female gender. Retinal vascular changes were 28%. Acute uveitis was only seen in 2% patients, the vasculitis one. None of the patients had CME. So conclusion is 60% associated in our small group of patients. So our recommend is pursue screening of all patients of demyelinating diseases to for the retinal and uveal manifestation as well, as we all screen them for the disc only. We have to examine their periphery and screen for cells and flare as well. Then try to understand the association between primary demyelinating CNS disorders along with the uveal and neuronal manifestations. And if possible, to response resistant to therapy can also be prognosed according to this. Thank you.
Thank you, doctor. 8 patients had blindness. Blindness due to what?
Ma'am, repeated attacks of optic neuritis. Like out of 8, as far as I can remember, there were 3 patients of CRION. So they had repeat attack of optic neuritis, severe disc pallor. And some patients had INS, and they also developed all those things. Mostly because of disc pallor, not retinal or uveal manifestations.
So in the light evaluation, how many patients had RAPD?
RAPD, if the attack was active, I took 50 patients who were clinically proven. Some had active optic neuritis, some didn't have. So as far as I can remember, around 30 patients had RAPD out of the 50. So disc pallor was the most significant finding, as I told earlier.
Were these patients ever examined before?
Some of them were these first-time diagnosed, so I examined them first. Some of them were diagnosed only for the disc findings and color blindness and everything, nothing else, not
But
for the retinal or uveal manifestation.
was never examined.
No,
Did they have any other comorbidities which could account for these manifestations? Did you exclude
Comorbidities
them?
maybe due to treatment like that. One patient that had microaneurysm, word has pulmonary hypertension. She had that. Some majority were treatment associated comorbidities, like they were on immunosuppression and multiple steroids because of that, but not previous comorbidities. As all the patients were younger age group, no? I told you 31 to 45 years was the majority population.
Just an observation, ma'am. You can correct me if I'm wrong.
Yeah.
You can actually split it into 3. There is actually only one. One is optic atrophy, which is the most common thing found because all patients are of multiple sclerosis, no doubt. On the other end of the spectrum, you have I think you have 1 or 2 patients of pars planitis.
Yeah.
That is the only actual uveitic entity which you'd actually described in all your these things. All the other findings which you described, given your median age of patients, you will find areas of peripheral chorioretinal atrophy. You will find a vein occlusion with the vitreous hemorrhage, atrophic retinal patches. These are very, very common findings which are picked up in a normal eye examination in anybody above 50-60.
But the vein occlusion, as you was telling, it was a very segmental vein occlusion, not a BRV or something like that you can expect in these age groups or something like that.
Just if you have time, I'll go back to the picture. It's okay, no problem.
Can you please project it?
Yeah, see. So that is
That is
typically where the vein occlusion happens, no? Inferotemporal vein.
inferotemporal, but it's not classic BRV that we see in these. And these were young patients.
How
and no
old
other
was this
systemic
patient?
comorbidities.
How old was this patient?
I don't know exactly, can't remember exactly the age, but she was young.
So looking at the other vascular changes and all, okay, this is easily a
RVO.
wrong side of 40 and at least a hypertensive. You look at the AV changes and all those stuff.
Unrelated to the demyelinating disorder.
Yeah.
The question is, how do you attribute these
Yeah, that's
changes
why I
the
place those 3 points
demyelinating
is
to
disorder.
demyelinating disorder?
exactly. That is what is running through our
It could
minds.
be that what we want to ask is that these could be incidental findings as
I
well.
agree to that. Yeah, for that to exist, to associate them with the demyelinating disorders, we had to do a follow-up study as well. We did only once a view study, so that time the finding could coexist.
Yes, so this is just a cross-sectional
Yeah.
observational study.
Thank you, Dr. Bharat.
Thank you.
Thank you.
Thank you.